Early morning in Querétaro, an industrial town north of Mexico City, and María Isabel and her mother Virginia have arrived at the state's General Hospital. Virginia has breast cancer, but given the recent federal healthcare budget cuts, she hasn't received any treatment in over 2 months. She lives 2 hours away, but stays at the hospital on a slim chance that someone might be available.
We've been everywhere, and wherever we go they tell us to look somewhere else. We're scared that the cancer will get worse in the meantime, so it's very difficult for the person who is sick.
Unfortunately, no medicine or treatment is available, and Virginia, like hundreds of others here, must go without help, with no idea when their medicine will arrive.
And it's not only cancer patients, but patients across the healthcare spectrum that are struggling. Last year, the federal government implemented budget cuts impacting healthcare, and since January, the shortage of medicines for hospitals has gotten worse.
This year, funding for the existing social security system has been cut by the federal government by more than $42 million. The president supports an alternative universal healthcare program called INSABI, the Institute for Health and Well-being.
This policy implies putting an end to ulterior motives, but there are those who don't want to stop stealing. They exert pressure and think that in this way we will relent on the decisions we have made not to permit corruption.
Yet, for some states controlled by opposition parties, such as Guanajuato, they won't give up control of their public health administration, but support transparency in the sector.
Guanajuato has made a decision not to accept the changes to the federal health laws. We hope that the federal funds will continue to arrive because we are committed to its efficient and transparent use without giving up our autonomy when it comes to health care.
As the healthcare standoff continues between state and federal officials, local charities are being impacted. Teresa Aguilera works for the local charity Fundación Canvides, which provides free medicine to those in need. She says so many desperate patients are now coming to them that they are having to split costs with even the most marginalized cases to ensure they can help everyone.
We believe healthcare is a right which should be afforded to everyone. Unfortunately, cancer is an illness that doesn't wait. A patient doesn't have the option of stopping treatment for a month or two because there's no medicine. For many patients, waiting isn't an option.
Just how many lives this political tug-of-war may cost before a solution is put into place remains to be seen. Alasdair, Baverstock, CGTN, Querétaro, Mexico.